that we have finished talking about the first step of the medical approach to a patient, let's talk about how AI helps with physical examination. I think most of you are familiar with the heart rate monitoring function of your smartwatches. It is one of the many examples of AI taking measurements of patients and normal healthy people. Other similar functions include checking anemia using cell phone cameras or pictures, and facial genotypes of genetic diseases. There are many stories about how smartwatches save lives in the newspaper all around the globe. For example, 18-year-old Diana was at church when she received an alert from her watch at a rapid heart rate. Her family rushed her to the emergency room, where doctors discovered her suffering from chronic kidney disease. 76-year-old Gaston was at a church service when his watch alerted him of a spiked heart rate. Doctors discovered that his 3 main coronary arteries were fully blocked. And 67-year-old Tora fainted in the bathroom and hit the floor hard. His smartwatch detected fall and called medical assistance and saved his life. After physical examination, we shall now look at how AI helps with diagnosis. I believe medical negligence is no longer news to any of you. But how can AI help prevent it? There are indeed many branches of healthcare that benefit from the advancement of AI. One of the greatest examples comes in radiology. Breast cancer is the most common cancer for women in Hong Kong. Normally, mammography is used to investigate the severity of breast cancer. Mammography uses low-energy X-rays to examine human breasts. However, mammography has a high false positive rate. In 2019, MIT developed a deep learning algorithm which anticipates the development of breast cancer up to 5 years in advance. And the results so far are far more accurate than mammography, especially at predictive pre-diagnosis discovery. Another example would be in ophthalmology. Diabetic retinopathy is a diabetic complication that affects the eyes. It is caused by the damage to the blood vessels at the retina. It can lead to permanent vision loss if it is not caught or noticed early. AI platform iArt was able to detect diabetic retinopathy with 95.5% accuracy. It does not require expert ophthalmologist input and can provide a reading in 60 seconds. It simply requires users to take pictures of their undilated pupils. In anesthesiology, Citizens is a machine that can administer sedative propofol while monitoring vital signs to ensure that a patient is anesthetized to the right degree. It means that only a nurse, instead of an expensive anesthesiologist, must be present while sedating a patient. Anesthesiologists have been against Citizens, claiming that the machines cannot replicate their skills nor handle emergencies. As a result, in 2016, Citizens was pulled from the market due to the poor sales. In another field of dermatology, researchers at Stanford have built an algorithm with deep convolutional neural network to classify mold as benign or cancerous. The algorithm achieves performance on par with experts and could potentially be turned into a mobile app for early detection of skin cancer. In cardiology, we have Arteries. It is a medical imaging platform for heart problem diagnosis. It is a self-learning artificial neural network. It is the first FDA-approved machine learning application used in clinical settings. Its results are as accurate as human physicians. It merely takes 15 seconds to produce a result for one case, while humans take 30 to 60 minutes. As you can see from the above examples, AI mostly helps physicians with image analysis. And there are 6 general steps for image analysis. The first one is image collection. AI must have access to the images of the patients. The second step is image cleansing. It involves the removal of duplicates and low-quality images to enhance the accuracy of the diagnosis. After that, it is image pre-processing. This step includes the cropping out of irrelevant areas of the images, normalization, and filling in missing data. The fourth step is labeling or tagging. It represents the identification of the diseases and disorders labeled by human physicians or extracted from other reports using NLP. The fifth step is model training. AI must adopt deep learning to train itself and improve its accuracy. And the final step is model evaluation. First, we detect facial landmarks. Then, with the help of image preprocessing, pictures will be normalized and cropped into different regions. In model training, AI processes the data using deep convolutional neural networks. Using this method, we can achieve an accuracy of 92% and 96.88% with Angelman syndrome and CDLS respectively. Apart from Down syndrome and Angelman syndrome, we can also predict the genotype of a specific genetic disease, Noonan syndrome, using facial features along with the help of AI. It is possible to predict the genetic makeup, at least the disease-causing gene mutation, using seemingly unrelated features, in this case, facial features. It can also lead to a wider application in healthcare, such as the identification of gene mutation in blood films in thalassemia or leukemia patients. It has already been developed for predicting underlying mutations in lung cancer patients using CT scan. And finally, we talk about how AI helps with treatment. Many of you have heard about robotic surgery. Robots can help surgeons to be more precise during a surgery. But do you trust robots for your own surgery? Is it necessary for us to use AI in robotics? Aren't Newton's laws enough to move a robotic arm around? In practice, Newton's laws are not too useful due to friction, wear, and tear in the robotic arm. Therefore, we need AI to micromanage the ongoing surgery. The most famous AI in surgery is the Da Vinci surgical system. It can even perform surgeries on grapes. It peels the skins of grapes and stitches them back. It gives surgeons an advanced set of instruments to use in performing robotic-assisted minimally invasive surgery. Another case in which we need the help of AI is in paralysis. Millions of people worldwide suffer from diseases that lead to paralysis through destruction of signal pathways between the brain and the muscles. Neuroprosthetic devices are designed to restore the lost function and could be used to form electronic neural bypass to circumvent disconnected pathways in the nervous system. In a 2016 study in Nature, scientists applied machine learning algorithms to decode the neuronal activity and control activation of the participants' forearm muscles. One participant achieved 6 different wrist and hand motions. He was also able to use the system to complete functional tasks relevant to daily living. We see how AI helps in different areas in healthcare. I hope you enjoyed this lecture. Thank you.